please make your way out of the building via the nearest fire exit to the car park beside the Windmill Public House. And microphones, which I've just mentioned, please ensure that the microphone is directly in front of you, switched on and logged in. Please not move the microphone from its set position, and when speaking, ensure the microphone is directly in front of you and not to the side or up high. And when you finish speaking, please turn it off. Thank you. Item number 1. I've calmed down now. Apologies, Howard, please.
Good morning, Chair. We have apologies from Councillor Hedges-Serafin, and we have Councillor Jenny Fradgley substituting for him.
Welcome, Jenny. I think you're here more times than most members of the... I'm not sure about Councillor Littlewood, so if I do hear anything from... I'll give us apologies as well, so thank you. Right. Item number 2, disclosures of interest. The usual disclosure of interest is part of each agenda. Any members? Councillor Wally Huggins, please.
Yes, I noticed that on this agenda that we're talking about business rates for the gateway site, Stratford-on-Avon. I think I need to declare the fact, and it's it's already declared, but I'm declaring the fact that my husband's company pays substantial amounts in business rates, and that those business rates are up to date and have always been up to date. Thank you.
Thank you. Any other disclosures? Councillor Keithley, please.
Thank you, Chair. I'm just wondering whether or not those of us that went to Ellen Badger for the visit ought to say that we'd been. It's a question, really. Because not everybody has been, but some of us have.
Yeah, I think that's fine. Yeah, I think that's a fair point. For all those indicate who did attend?
I was referring to the organised visit for the OSC. Sorry, Chair. I was just referring to the organised visit for members of the OSC.
Yes, I think. Yeah, I interpreted it as that as well. Councillor
Thank you.
Keithley, so.
Not ad hoc visits.
Yeah, the organised one. Yeah, that's right. So.
Yeah, I suppose I ought to declare, I've been on an organised visit beforehand, but I don't know if I ought to declare that I'm a councillor for Shipston, but I think other councillors in this room are probably would use the Ellen Badger Hospital as well and be involved in what's going on.
We will note that it's in your ward, Councillor Pascal. So, Howard, have you got all the people who attended the official organised OSC visit?
Did you want another show of hands for the organised visit, Howard?
You got.
It's fine. I've noted that everyone's
Thank
apologies.
you. Thank you, Chair.
Councillor Rolfe, did you indicate, or are you just putting your hand up to say you went on that visit? No, you had your hand up at the same time as Stuart has, so I assume you're putting your hand up to say you were on the visit. Right. Thank you. Any other points on this one before we move on? Right. Item 3 is minutes of the previous meeting. The meeting of the minutes held on the 2nd of July. Any comments about those? Or is the committee happy they are a true record and I can sign them at a later date? Have we all agreed on that? That was no dissension anyway, so that was good. Chair's brief. Again, nothing today for the Chair's brief. So we'll move on to item 5, public participation. I've not received any questions from the public. No later additions on the Howard? No. Brilliant. So we'll now move on to item 6, which is the South Warwickshire University NHS Foundation Trust, to consider the options for the Ellen Badger Hospital in Shipston-on-Stour. And we have 2 gentlemen here who we also met on the site visit, Jack Foster and Adam Carson. So thank you, gentlemen, coming to our place today rather than us coming to you. And thank you again once for the hospitality shown during the visit. Councillor Rolfe, please.
Yes, Chair. Is it possible that these gentlemen could give their full names and title, please? Thank you.
Yeah, I'm more than happy to do that. Far away, gentlemen.
Thank you very much. If I kick off, I'm Adam Carson. I'm Acting Chief Executive of South Warwickshire University Foundation Trust and George Eliot Hospital.
Good morning, everyone. I'm Jack Foster. I'm the Associate Chief Operating Officer for the Out of Hospital Division at Swift.
Thank you. Right then, gentlemen, just checking about the presentation, and it was all okay. Who's going to kick off first?
I'm going to kick off and I'll bring Jack in. So, as I say, I'm Adam Carson. I'm Acting Chief Executive of Swift, and Jack runs our out-of-hospital division, and Jack is definitely the service delivery expert, so he will come in to the part of this presentation where we talk about the services delivered at Ellen Badger. I want to start with a bit of context about how we've got here and the process for getting here, though. So if we could go to the next slide, please, Howard. Thank you. So just a bit of context, first of all, about why we've chosen to develop the Ellen Badger Hospital. I think we've recognised for some time that the facilities previously in Shipston and Stour didn't meet the standards we expected them to. So they were old buildings which required significant development, and they didn't provide the space or flexibility to deliver integrated services of the nature that we're delivering to communities today. I think also there is a real opportunity in Shipston-on-Stour to do something different. So recognising the physical distance between Shipston and our sites at Warwick and indeed here at Stratford, there was an opportunity for us to do something different for the community of Shipston. And that's the process we've undertaken and which I'll talk a bit more about today. There was also an opportunity nationally, so some funding was made available for the development of community integrated health and wellbeing services, and we wanted to grab that opportunity while it was available. It was very time limited. I'll talk about that a bit more in a moment. And we also knew the national direction was changing. So a hospital isn't seen now as what it was 20 or 30 years ago. Hospitals, and indeed this is reinforced by the 10-year plan that was published recently, have shifted a focus towards care, providing care in the community and towards prevention, and you'll see that writ large all over the 10-year plan. We as an organisation have a real focus on admission avoidance and providing care at home safely in the most appropriate way, and Jack will talk a bit more about that in a moment. I understand the tension about calling Ellen Badger a hospital, but I firmly believe it is a hospital. I firmly believe the kind of services we are providing there makes it a hospital. Again, Jack will talk about some of those and some of the development plans. We wanted a space that was flexible. We recognised that, as we've seen over the last 30 years, over the next 30 years, healthcare will change considerably. So we wanted to develop a facility that was flexible and able to respond to those changes in demand and changes to the way we provide care. We also were very keen on developing an integrated service. So traditional model hospitals provided secondary care services is not the case today. We see the development of facilities that include primary care, secondary care, and voluntary sector services, and we understand and can see that integration of services, putting different services in a single building, helps organisations work more effectively together to provide care. We also know that hospitals are not always the best place to get better. And you can see that in the way that care has changed over the last 20 or 30 years. So developing a facility that allowed us to base enhanced community services to support people better in their own homes was a real focus of this. We've used this model elsewhere, so we've got facilities in Rugby. We developed a new facility in Lillington in North Leamington a year or so ago, which co-located primary care and community services. But Ellen Badger is innovative in that it's the first of our premises where we're delivering the range of outpatient, secondary care outpatient services that we are, traditional services that would be provided in a traditional acute hospital. And again, we'll talk more about that. If we could have the next slide, please, Howard. So I will talk through this timeline very briefly, just to give, again, some context. So the process really started in 2018 with a review commissioned by the CCG, as was about the future of Shipston Medical Centre. And that report recommended development options, one of which was an integrated facility on the Ellen Badger Hospital, again, getting that benefit of primary care and secondary care together. At the same time, as I say, we knew Ellen Badger buildings were at the end of their life, or at best needed really significant investment to improve them. So we, as a trust, developed a business case recognising the national funding that was available and approved that. We appointed a contractor to start the demolition work in 2022, and that was quite a complex process because the old buildings contain asbestos and needed careful demolition. There was then the review of community beds, which was kicked off by us and, as you know, furthered by the ICB and concluded earlier this year, which caused some changes to that building and the use of that building. Construction itself commenced in May 2023 and ended in May this year, and there were various changes on the process, delays due to unexpected issues in the construction, the ICB decision on community beds, and some of the changes I've talked about in the context. The building has now opened, which is great news. The fit out of the medical centre on the first floor of the building is underway, and that work is completing in October. There'll then be their handover period, but the medical centre, I believe, intend to open that towards the end of this year. If we could go to the next slide, please, just a bit about the funding. So the total cost of development was just over £10 million. That was made up of around £6 million of capital provided by the Trust, 3 million, just under 3 million of national funding, as I've mentioned. That was time-limited funding. There was a short window in which we could receive and spend that money, which dictated some of the timelines. And then there was 1.4 million of community infrastructure levy SIL funding, which supported that. And that was made up of 900,000 to SWIFT, and there was specific reference to health and wellbeing in that funding, and 500k went to the ICB to support the fit out of the GP facility. If we could do the next slide, please. I know there's been a bit of confusion about the GP services at Shipston, so I just want to clarify absolutely what the plan of the medical practice is, and this is from them, not from me. So as you may be aware, the practice currently provides its services out of two buildings, the main medical practice building and a building they refer to as number 8. Number 8 is not fit for purpose any longer in terms of accessibility and in terms of the facilities they're able to provide there. So the practice want to dispose of that building. We have worked with them to provide a long-term solution to provide space in the Ellen Badger building, and that will provide them with 11 consultation rooms, 10 clinical rooms and 1 treatment room, which they'll be able to provide standard GP type care in. And the coming online of those buildings will allow them to dispose of the premises at number 8, which is out of date, but also do some work on their main site. I think they've got some issues with the roof and whatnot there that requires some investment. So they'll be able to rely more heavily on the Ellen Badger site where they do that work to bring the other site up to standard. But their plan is a long-term 2-site solution, and as you can see on the slide, that will support with parking and challenges with the current slide and so forth. The building work hands over at the end of October, as I say, and then there'll be a period of them commissioning that space. So hopefully there'll be appointments offered there towards the end of this year. If we can move on, please, and I'll hand over to Jack to talk about the service offer.
Thanks, Adam. So, as Adam said, we opened not too long ago, but we had 8 services that went live immediately as the building was operational. So these are specialist Parkinson's nurse-led service, physiotherapy outpatients, heart failure nurse-led service, bladder and bowel specialist service, or continence service as it was previously. We've got catheter clinics running, Admiral dementia services set up, community midwifery, and speech and language therapy. So at the minute, none of those services are consultant-led, but a number of consultant-led services are in the next slide, which I'll get to, on services we're currently working with to try and establish services there. In terms of how we'll monitor how services are operating there, how successful they are, and looking at if we need to flex between services, we'll look at patient satisfaction from the services that are running there. We'll look at utilisation metrics for the clinics, cancellation rates, did not attends. We'll look at the waiting list size or the caseload size of services to see what demand there is for services, especially from this population. We'll look at RTT, referral to treatment performance, so looking at waiting times and therefore, what again, linking that demand for services to what we look to mobilise into the building. Look at length of stay on caseload for some of our community services that are setting up there, and new to follow-up ratios as well, which is another kind of standard outpatient metric that we'd use. So we'll use that to make sure that we're getting value for money from the services that are running from there, that they're efficient and that they're effective, and they're making the best use of that space that we've got at the Ellen Badger Hospital. Next slide, please, Howard. This then is a significant range of services who we're currently in conversations with around establishing an offer from the Ellen Badger Hospital. Again, a number of these would be consultant-led, ENT, rheumatology, gynecology, obstetrics, diabetes. If they base themselves down there, we'd expect them to be consultant-led services. And again, we're looking at some of that same data source in terms of waiting list size and demand on services to help drive what would be most appropriate and beneficial to this population for us to set up from the Ellen Badger site. Next slide, please, Howard. And then one of the very exciting developments is a medical day case unit pilot that's going to be commencing at the moment from the 6th of October. So we have a medical day case unit at our site in Warwick. It's very effective to manage urgent and emergency care for patients and have them treated on the same day. It's a fast evolving model and very forward thinking, so we're very excited to be doing a pilot of this model of care down in Shipston. So the operating model for the medical day case unit pilot would be that it runs 5 days a week from 8 AM to 4 PM. It would be consultant-led, so it would have consultant oversight at all times, but we would have the clinical lead consultant based down there 1 day a week, but an advanced clinical practitioner based down there amongst the other clinical workforce permanently. We would receive ambulances to the unit, so through our various triage methods and our call before convey service, where we've got a link with WMUS where they contact us before they convey any patient to hospital. That's where we could redirect them to the Shipston medical day case unit if need be. And then various transport services that we have running from various sites of ours would offer transport home as well. We're still working on the range of treatments and procedures that would be offered, but this would include blood tests, iron infusions, blood transfusions, comprehensive geriatric assessments, and we're looking at a whole raft of other interventions that we might be able to offer from that site. So we've got a clinical group set up to scope that currently. We've got a meeting this Friday with the GPs because this is an exciting opportunity that we want them to be very involved with in terms of, referral pathways into this unit from the practice themselves, and in terms of collaboration and support that each could offer. And like I said, we're expected to go live with that on the 6th of October. And then just to touch on a few, next slide please, Howard. Just to touch on a few other elements of some of our services, not necessarily directly linked to the Ellen Badger Hospital, but we have a number of virtual wards that we run as an organisation, so frailty, respiratory, acute medicine, high intensity users, and OPAT, outpatient perientral antimicrobial therapy service. There's some data there on the frailty virtual ward, which is our busiest one and our longest running virtual ward. We have on average 20 patients on the frailty virtual ward. We have an average length of stay of 3.6 days, but they can stay on the virtual ward for up to 14 days. It's a consultant-led virtual ward. We save a significant volume of bed days by treating those patients out in the community. So we have a number of our frailty consultants and our community ACPs, advanced care practitioners, who are caring for these patients out in their own homes and who are discussed and managed and monitored on the daily virtual ward round. Next slide, please, Howard. And then just a final slide, I just wanted to touch on the range of some of our community services across Warwickshire, but that are offered down here in Shipston as well in the surrounding area. Our Urgent Community Response Service, UCR, is something that's seen a huge amount of growth recently for a variety of reasons. We've done a lot of pathway development around our Falls pickup service. We've done a lot of work with WMUS now where we have live access to their CAD portal, so we can see all the calls that are logged with WMUS that they're currently not out to, and we pull off that CAD portal and we send our ACPs and our nursing teams out to these patients. We've seen activity grow by 50% over the last 2 years. We're seeing on average about 3,000 patients a month now, and that's either responding within 2 hours for a certain criteria and a certain cohort of patients, or on a same-day basis. So that really good advancements with that service. I won't go through all of this range of services in a lot of detail, but just to pick out another one that's seen a lot of development over the last 2 years, that's our community recovery service. So this is a discharge pathway for patients leaving the acute hospital, which offers care at home and therapy at home as well. Again, we've increased the capacity on this pathway now, and we're seeing over 3,000 patients per year come home on the CRS pathway. So that's increased the volume of patients each year who are accessing therapy in their own home on discharge from hospital by nearly 80%. So that's a huge development for us, and it's showing that shift from bedded care and hospital care to get people out of hospital quicker into their homes quicker, where we can do that more valuable assessment and that more valuable therapeutic work with them. But there's a full range of the services we offer in the community there, and we are planning an engagement event for down in Shipston where we'll bring our teams down, we'll set up stalls, we'll use the Ellen Badger site to do this, and people can come and hear the full detail of the services that we offer, because I think we're aware that some of this might be a communication and awareness issue quite on the plethora of services that we have to offer to this community. But that's all. Thank you, Howard.
Thank you, gentlemen. Very comprehensive. Before we start the conversation and the questions and that, there's a couple of things I would like to crave your indulgence with, members. One, I think we need to make sure we're asking questions in a polite and respectful way. And secondly, whilst I'm prepared to give members some leeway to set the scene about the questions, please can they get to the questions quite promptly? Otherwise, the meetings will drag on, and if we're still here 5 hours later, it won't be doing our stomachs any good, because I want something to eat by then. So before we start, we'll start then. Councillor Wally Huggins, do you want to come in, please?
Yes, hello gentlemen, thank you for coming in. I noticed that in your one of your slides you talked about the costs and the money and where the money came from, but what you didn't put into that was the money and donations that you received from the Ellen Badger Trust, and I think that is a little bit it is disingenuous of you to not do that, because it couldn't have gone ahead without them sort of giving you the opportunity and that donation. So could you explain why I've got another question as well. I'd like some explanation as to why the Ellen Badger Trust wasn't given that recognition in that slide, please.
Could you put your answer up?
Yeah, fair comment. The trust capital section of that slide was made up of capital from a variety of sources, some of which was the donated funds. So while it didn't draw that out specifically, it was regarded as trust capital, which we used for the development.
So can you just, for the clarity of this meeting, can you, although you've bunched it in with the others, can you please tell this committee how much you received, please, from the Ellen Badger Trust in both property, monetary value of that property and money donation, please?
Yes, so there was, and I'm reading from details here just so I get it correct, there was a £635,000 gift, and that was predominantly from the Percy Lomas legacy, which stipulated that the funds should be used for health and wellbeing services for the local community.
And what about the actual building and land, please?
So that is the gift that was provided. That was the money that was provided by the League of Friends, and I say that was predominantly from the legacy. I think it's just important to say that the money was used to purchase the land, as you say, and the League of Friends at that time agreed with the use of the money for that purchase.
Thank you. Moving on then, and I think this is...
Councillor Wally-Huggins,
I had one more question.
Can I just bring Councillor Rolfe in and then you can come back? I don't want to, yeah.
Is that all right?
If members are happy...
It's completely different to that question, but thank you for that answer. If we move on to what your colleague here was talking to us about, which was the ambulance service going to Ellen Badger instead of going to, say, Warwick. But one of the things, and that they will be using ambulances, one of the things that I wanted to get to some grips with over that is, where would those clinics be located within that building, please?
So all of the clinics on the slides that I just shared would be located in the new building. The MDCU, the Medical Day Case Unit pilot, is going to be in the old estate at the minute. And then once the pilot is complete, we then look at how we can provide that service within the new building. And just to clarify on the ambulances, so ambulances wouldn't go directly to MDCU at Shipston on their own accord. It would be on liaison with us if we wanted to filter those specific patients for those specific interventions to the Medical Day Case Unit.
Thank you. And finally, I must say to you that I found the term BABS a very derogatory term. I'm from the north of England, and BABS directly refers to the process of defecation, and to have that as your as a word, I found pretty tricky. But that's not to do with this. But I'm just saying
please,
that.
Councillor Wally-Huggins. I didn't quite understand that. I might have missed that as part of the presentation. But yeah, could you just clarify that point? Make it simple so I can understand, please.
So you referred to the bowel and bladder services specialism that would be going into there, and it's a much needed one. I understand that from experience within my family, but an acronym of using BABS I found a derogatory term, because in the north of England that actually does refer to defecating oneself, and I think that should be looked at. Thank you.
I can take that away. We did do some engagement when we rebranded from the continent service, and there was a range of patient feedback we had as why the continent service was potentially not the best description and title for that service. But that's something that we obviously didn't come across as we would have reviewed that.
I think you've acknowledged it. You take it on board, and if you don't know about these things, you can't do anything about them. So I think it's if people have an issue with that, it's right to be raised, and then it can be addressed.
I think that language use throughout the country is important, and I think that I'm shocked actually, but that is not to take away.
The problem is that terminology is different throughout the country, and what might be acceptable in one part of it or some form. Has a different meaning in a part of the country. I don't think it was done deliberately. It's been raised, it's going to be addressed, and I think we can draw a line under that one. Councillor Rolfe, please.
Actually, I wanted to ask what happened to the written questions. Have we had responses to those? There was a whole lot of written questions which we have been sent by Howard that have been sent directly to you. Have we had responses?
No, so the query questions that members have sent to me have been sent to all members and sent to Adam and Jack, and we can address them today. Anything that hasn't been addressed in the presentation already, members please feel free to put your questions to Jack and Adam today.
May I make a suggestion that you very quickly go through the answers to those written questions before you open it up to the floor, please?
Well, we'll do it in a way that we see fit. But if you want to raise your questions that you've written and put forward first, then members can raise their own questions, whether they be the ones they've submitted or they've got other questions they thought about. I'm more than happy to do that. So if you want to go through and raise your question, far away, then Councillor Rolfe, please.
I have 2 points. Going back to the use of the word hospital, I mean, the English definition of the word hospital is an institution providing medical and surgical treatment and nursing care for sick or injured people. So I would quite like you to re-look at using the word hospital, because currently it will not be used for that. There will not be any operations or doctors there. And secondly, have you seen the interview with Jane Blakely in 2018, where she promised award to the Ellen Badger Hospital? Thank you.
Yeah, okay, Adam, do you come
Yeah,
back on
so
that?
I take your point about the word hospital, but I do think we are providing medical care. I think some of the interventions Jack's discussed in terms of the medical day case unit certainly would be regarded as medical care and treatment. I do think that what a hospital is has evolved, and I think we've seen that further in the 10-year plan, and I think it recognises the innovative and very different centre that we've put in place for the Shipston community. In terms of the interview with Jane, I did see that, albeit quite a long time ago, so don't test me on the contents. But
I've just seen it.
Okay, but as you say, it was in 2018, and we know a lot's changed since 2018. We've had the bed review, we've had changes to the way integrated services are provided, and obviously we've had the 10-year plan published in the last few months.
Yeah, Councillor Alcott, please, then Councillor Johnson, and then Councillor Rice, please.
Okay, thank you. I saw on the slide you went through with the different services, there's nothing there for mental health, no mental health support whatsoever, but it's such a big area, it is desperately needed. Is there a plan to bring that in the future?
So I absolutely agree with you, and we'd love to have mental health services co-located in the building. There are elements of primary care mental health that obviously will be provided by the GP practice, but in terms of secondary care mental health, it's a conversation we've started with Coventry and Warwickshire Partnership Trust, who obviously provide those services, and I would like to see that as well, and we'll continue to have that discussion.
Okay, thank you. So when will we be able to get an update on when that could be coming in then?
I would like to be able to update you by the end of the year at the very latest, but I will certainly provide an update when we've got one.
Okay, and also then the same sort of thing really. There's no children health services listed on there. What about X-ray facilities? I mean, these are all things that are needed in this sort of medical centre. I do agree with Councillor Rolfe. I don't believe you can call it a hospital, but this is something that is needed. And I'm just wondering why, for say children's health services, are parents really going to have to travel to Stratford for children's health services? There are a lot of things lacking in this currently, and mental health, children's health service and X-ray service are vital for this sort of medical facility, and I would like to see them coming forward sooner rather than later because of how overstretched these services already are, especially at Warwick Hospital.
Yeah, so a couple of points there. Firstly, on the other services being delivered there, I absolutely agree with you that there's more we could do, and as Jack discussed, there's certainly things that we're looking at there, and our hope is we're able to provide whatever services that there's demand for in the local community. But just back to the context I provided at the start, Ellen Badger isn't meant to be a static building. This isn't meant to be a finite list of service, which is all we'll provide there. We will continue to evolve, and we'll continue to provide more there. We were really keen to start small and start with the services we knew we previously provided in the Ellen Badger building, and we'll go from there. So over the coming years, you'll see the services grow. In terms of diagnostics and x-rays, you may be aware there's been a national direction to consolidate and bring those diagnostic services together. And that has meant that we haven't put diagnostics in the building at Ellen Badger, and we've built the new community diagnostics centre here in Stratford, which opened a month or so ago. And that's where all of our diagnostic facilities are located, and that's the national direction. Having said that, I recognise that providing diagnostics in local communities is important, and we've kitted the Ellen Badger site out with the connections to provide the mobile scanner vans should the national direction change and should we need to provide those there in future.
Councillor Johnston, please.
I just want to follow up on my written questions. I think I'm right. Construction commenced in May 23. Now, I know there's no one here from the ICB, and this may be a question I ask of them in a couple of months' time. But it just seems to me to be poor management that within 6 months of the construction commencing, they came to us to say we are going to be reviewing the beds, the rehab beds. It took them a year to come forward with a proposal. And all the time, this investment is being made. And it just seems to be, this I would have expected someone to have thought about, but we are building a building to accommodate rehab beds. But when reviewing the service, it's the wrong way round. You surely should review the service first and then decide on your investment in the building. And I got the impression when we visited a few weeks ago that to a degree that your trust went ahead with the construction with a degree of risk. You were aware of a risk. And I think you're making the best of a bad job, really. I'm not sure this building was designed for its current purpose, and we're trying to make a use fit with it, and I may be being unfair. But
yeah, so to be clear, regardless of the beds issue, there was a need to redesign or redevelop the Ellen Badger site because we knew the buildings there weren't fit for purpose. And that centre building, the bit that's been built, was always designed for outpatient services, health and well-being. We've added the GP practice into there because of the funding shortfall in building a separate building for the GP practice. But I do think we now have a building that provides an integrated healthcare service in a way that we couldn't before in Shipston, and I do think it's a great opportunity. I do think it's a fantastic asset for the local community. As I say, despite the fact we provide services across Warwickshire, it's the only place we'll be providing those secondary care appointments, some of which are non-consultant led, some of which are consultant led, and that's not something we do in other health centres. Certainly in the other areas we've built integrated facilities such as the facility in Lillington. We've seen really tremendous benefits from voluntary sector, primary care and secondary care services being co-located on one site and able to talk and share and develop their services together. And that was always the intention of this main building of Ellen Badger, and I think it is a fantastic opportunity, and I think it will allow us to provide services in a different way.
Hello, for you, okay. Thank you. Councillor Rice, please.
Yes, I have quite a lot of experience with 3 parents in end-of-life care and in the months and years leading up to that. And so I know the real issue, apart from the NHS being very poor with end-of-life care, is the issue of old people in hospital beds where the NHS can no longer really do anything for them, and they should be sent home, but they can't be sent home because they're not fit to be sent home, but there are no halfway houses, if you like, and I mean beds. So I was just wondering, the Community Recovery Service, how many hospital beds is that saving, and what is your target for saving hospital beds in this area, but particularly in the Shipston area? And I do have a second question, if I may, but that's the first one.
We didn't specifically have a target for saving hospital beds, so we've got some data on the Community Recovery Service which shows that there's a reduced length of stay, we're getting people out of hospital quicker, and we can convert that into a bed day saving, and we can put a financial value on that. Unfortunately, demand on our services is growing, so we're not actually able to release and see the benefit of that released capacity.
Okay.
Have you got a follow-up, Councillor Rice?
Well, I've got a completely different question.
Carry on whilst you're in the chair.
Well, okay, thank you. No, I was just wondering about the, the offering, the current offering at Ellen Badger. How did you decide on those, that offering in terms of clinics? And the frequency, because I noticed there's physio, I seem to remember, was 40 a month, whereas something else, and I can't remember exactly what it was just one a month. And speech therapy. How did you decide on that offering, and how did you decide on that frequency? And surely those decisions will affect the results that you're looking for to decide on how you develop the service.
Yeah, so a range of different things. Predominantly those are the services that were offered there previously, so we already had the workforce enabled who had been temporarily relocated to other areas to come back into that. We've looked at demand on these services in terms of the size of waiting lists and how many patients we've got ready to access these services, and physiotherapy is one where we've got a huge demand, which is what's driving that frequency of those sessions, whereas the others' demand aren't quite as high, and some of these are delivered by nurse-led services who are part of our community teams, so they'll be doing so much of their work out in people's homes, but for those who they can, they'll bring into outpatient clinic appointments.
I just wonder, the thought occurs to me, to what extent are those choices self-fulfilling in terms of the results? In that, if you're only offering speech therapy once a month, you don't get much demand.
So we have a number of ways we can monitor that demand in terms of waiting list and caseload size. So it's not necessarily self-fulfilling, because we'd see the size of that backlog rising, which we've had experience in a number of specialties. Obviously, we're constantly looking to bring our waiting times down across all of the services that we offer as an organisation. ENT being another one where we've got waiting times are a challenge for us at the minute. So I don't think that demand is necessarily driven by the capacity that's on offer.
Thank you. Councillor Passingham, please.
Oh, thanks. Yeah, I've got a couple of questions I can ask now, but there were 8 questions in all that were sent to me and I forwarded to you from various residents in Shipston, and some of them you've answered very well, so thank you, but there are some other outstanding ones. But
do you want to do those, Dave? Do the outstanding ones while we're here.
Yeah, okay.
You've got a pen to tick off the ones you've already been answered? Or
Yeah. So this is really to do with the first question about the lift, but there are other, it's not just about the lift, because and you missed out from the timeline that you went through, that originally there were plans drawn up for 3 buildings on Ellen Badger's site, one of which was a hospital, another of which was a medical centre for the GPs, and another of which was the Health and Wellbeing Centre. And the District Council passed all those plans, I think, 3 to 4 years ago, and another plan was put in for the Princess Diana building, which was a 1960s, 70s building that had been mainly funded by the Friends of Ellen Badger, and you put in some plans there for 8 bedded units, I think. So there were all sorts of plans up to 3 years ago for a proper community hospital with step up, step down, end of life, all sorts of beds, not just rehabilitation beds, which was one of the controversies over the consultation. But at some point or other, all those four buildings were all put into one, which was originally planned as a health and wellbeing centre. And that building has just got one small lift that can't take a trolley. Most of the medical services are not on the ground floor, so people who've had disabilities and can't manage to get up the stairs, they're all going to have trouble getting up and down the stairs if the lift breaks down. So obviously that building was not built and designed for what the purposes you're trying to put it to now. Have you got any comments in general on those points?
Yeah, so a couple of points there, I think. So the building, as you say, and I referred to it on my first slide, although I didn't say it verbally, was originally three phases. But I think important to note that the inpatient phase of that, or the inpatient building of that, was on the site of the current Princess Diana building. The planning obviously changed, as you say, when the community bed review happened. The main building, the building in the middle that has been built, was always designed as a health and wellbeing hub, as you say, but there were also always outpatient facilities planned for that building. I think the part you reference about the beds in the Princess Diana building came later when the community bed review happened. So recognising the significant cost increase for the building of a whole new building with inpatient beds in it, an option was reviewed to convert the current Princess Diana building to include a number of beds, as you say, and that's what the ICB consulted on. So those plans weren't in existence at the same time. That was a later plan recognising the cost increases. In terms of the building itself, as you say, it does have one lift. That is fairly standard for a building of its size and type. And clearly that lift has a robust maintenance contract and so forth to ensure that it's got 24 hours cover. But there is always a risk with mechanical breakdowns, as you say. I think we're lucky in that we've got the space on the ground floor and there's a continuity plan in place. If that lift was unable to be used, we could use the facilities on the ground floor to see patients who weren't able to get up the stairs.
Right. Thanks.
If your second question could be a bit quicker, Dave, please, than the first one. I'll give you a little bit of leeway on that one.
There's very complex issues here, isn't there? So, yeah, I'll try. So, the Community Recovery Service, there was a pilot scheme, pilot scheme for virtual wards and dealing with people in big rural areas. And we've never seen any evidence or impact assessment of how successful that was, how the impact of withdrawing community beds from Shipston has been to such a large rural area. And I'll try and keep it short. But I'm glad there is a community recovery service because during the last 3 years, with my experience with various neighbours, frail old neighbours, they've been sent out early. Their care packages have been for carers that have come from Coventry and places like that didn't always turn up. The care workers weren't qualified to give medicines and medication in the morning, and quite often the people who've been sent out couldn't do it themselves. So there were all sorts of issues because we're so remote in rural areas that weren't being covered. So I don't know if you've got any further studies and impacts assessments of whether this can cope with the situation that we've got in Shipston.
Sure, thanks. Jack may want to come in. Jack certainly shared some of those details of the virtual ward and community recovery service when he was talking, but I'm sure there's more we can provide to you following if you're interested. I think one of the things I would say is that one of the great things about the new Ellen Badger development is that we're able to base our community teams there. Shipston Home Nursing, hospice at home type care will also be based in that building. So they will be in and close to the community they serve. Did you want to add anything, Jack?
Yeah, I guess it's tricky to pick up on if there's been specific issues that people have experienced, but it's sad to hear that, and any feedback we get of that nature we'll of course investigate and look into. In terms of carers coming from Coventry and not turning up, because that's not the kind of service level we want to offer. We work very closely with Warwickshire County Council, who commission the care providers. So we work with a set number of care providers on the community recovery service, and we work very closely with them, with our therapy team, to ensure we've got a collaborative relationship in terms of the care we're providing. We do have capacity to meet demand for that service. Patients are getting out of hospital very quickly. Within a day of referral, they're able to get back home, and the care providers, we've got a service level agreement where they get to the patient's house within 2 hours of arriving home. So any instances where that kind of level of service isn't being met, we'd look to get involved and understand why that's happening. And of course, I've shared some data on the community recovery service, but I can provide more in terms of the exact numbers from this area, from this region, who are accessing that service and how that has changed over time. Yes, like I said, Warwickshire County Council commission with private care providers within the domiciliary care market. So they're not employed by Swift. The therapists who provide the therapy interventions in people's home, they are employed by Swift. And if patients come out of hospital and still need clinical interventions, they'd also be on our district nursing caseload in terms of giving medications, in terms of wound dressings, and wound assessment, that kind of thing. So they might be seen by our district nurses at the same time.
You oversee their training and their certification of being able to do the job?
For the domiciliary care, yes. Yeah, there's a very robust contracting process and commissioning process that the Warwickshire County Council undertake for us, and they manage the quality side of that contracting arrangement as well.
Right, okay. I think I'll ask a question now. I've got two. Everybody else has had a couple. The mental health service that you're potentially looking to bring in, or perhaps in discussions. I know when we visited the site, and you've mentioned as well that you've got the flexibility in that facility. If this service comes, how will that be accommodated in the new facility, please?
I think there's a couple of ways we can do that. So obviously we've got the health and wellbeing space on the ground floor, and not all mental health interventions are structured medical type appointments. A lot of that happens in wellbeing and prevention. So we've certainly got capacity in that wellbeing space on the ground floor to provide some of that. We also have capacity in our outpatient clinic rooms for mental health appointments to be offered there, should the Mental Health Trust wish to do that.
And my second question relates to working with the GP practice. I think I heard you say that you're potentially looking at joint working with them and potential direct referrals. So it'd be interesting to see how that works. And would you be able to, if that worked as a pilot, would you be able to extend it to work with other practitioners and partners?
Yeah, so again, we've seen this a little bit at the integrated facility we've developed in Lillington, and a lot of that happens informally by general practice and community services being co-located together. They have conversations, they're able to access, the GPs are able to access the community teams to have a discussion about a patient and the kind of care. You tend to find referrals to some of those specialist services go up as a result of them being located in the same building. But certainly our approach is to integrate as much as possible and to be having conversations together, working together. The 10-year plan talks about neighbourhood teams and the development of neighbourhood teams, where primary care and secondary care are working extremely closely together to provide interventions, and we're just at the start of the journey to look at what those neighbourhood teams look like now.
Thank you for that. And so just to be clear, as well as formal referrals, there are potentially informal conversations between partners happening that are potentially having benefits to the local community.
Absolutely. I think that's one of the main benefits of having an integrated centre. You get people working together who would previously have been in their separate buildings and not seeing each other.
So, and I will shut on this is my last point, and I'll go back to people who haven't spoken and then go round on a second round. It'd be interesting to have some feedback. I know there's confidentiality issues, but your co-location at Lillington, some of the benefits you hadn't thought about when it was originally formed, they're occurring naturally. So again, if you could let us have some details about that, that would be helpful as well.
Sure, I'm sure we can provide some case studies. I'm not sure if Jack's got anything off the top of his head, but we can certainly provide some information on that.
Right. I'm mindful, I know there's at least one member who's asked questions and wants to come back again. Are any members who haven't spoken or raised any questions on this subject want to come in before I'll go round on the second round? No? Councillor Wally-Hoggins, you can come back in again, please.
Sorry, I do. My ward does actually feed into the Ellen Badger and to the Shipston Medical Centre, so it is important. It's very close to my heart as well. So, I think it would be fair to say that there are many residents in the Shipston area that are really disappointed with what's gone on at the Ellen Badger. And indeed, at the visit that we had, we said that perhaps the PR strategy could have been a lot better from yourselves. But I think that one of the key things that is at the heart of sort of how disgruntled people are, and I think that's me being polite, is that we had this survey, didn't we? It went out to consultation and everybody could take part in it. And, there were preferred options, but even people not living in Shipston-on-Stour, far and wide, said that the rehabilitation beds should be spread throughout the area. And yet, despite that consultation, you still continued to go down the route that you wanted to go down, not the patient-led, if you like, response. So the question that I've got to give you, do you not see that this raised false hope for the residents of Shipston? And also, what was the point of doing this? Because really, you had no intention of changing the direction of travel. And I think sometimes when it's this bad, and it is really bad in Shipston, the attitude and sentiments towards the Ellen Badger, I think somebody at some point needs to hold their hands up, wave the flag and say, we got this wrong and we're sorry. Because at the end of the day, sorry, yes, the question that I've got is, why do the survey if you didn't respond to what people throughout the area wanted?
Could you just, which part of the survey in particular that they didn't respond to, just so we're clear?
Consultation, when they did the consultation and the members of the public responded to it, there's a massive push. There were there were that let me help you fill this form in for the older people that couldn't access things online. Everybody was sort of reminding people to complete this, the consultation, and yet the response was overwhelmingly that the rehabilitation beds should be spread throughout, including at the Ellen Badger Hospital. And yet, you've ignored it. So why was? Am I not allowed to ask that? Why was it ignored?
No, I think it was the ICB consultation. It wasn't Swift, was it?
Okay.
Yes, absolutely. Just for clarity, the consultation was run by the ICB being our commissioners, and we can only provide what we're commissioned to provide. I do understand your points about the PR, and I think there are things we could have done differently. We have ultimately provided a really fantastic, innovative facility that meets the demands and requirements of the 10-year plan. And if that message hasn't got across to the community, then we need to do better to make sure they do. I think there's also a misunderstanding or a lack of knowledge about the breadth of community services offered and what those community services do, because there's some absolutely fantastic work that is done, and we know people are getting better and staying better as a result of those community services in a way they didn't before in hospital beds. And as Jack said, we're planning an engagement event in Shipston to talk about some of that a bit more.
If you could let us have details of that community engagement event, so as many people can publicise this. I know obviously Councillor Wally Hoggins, Councillor Passingham in particular would be noting of that, and I'm sure we'll encourage many people to go as possible. A quick follow-up, Councillor Wally Hoggins, and then we'll move on to other members.
Yeah.
Just again, if you could keep that question, sorry, no, it's a point of helping, I'm not cutting you in. If you could keep that point you raised about the consultation for when the ICB come in November, that would be a fair point to ask it. It's not fair to ask the gentleman here because it wasn't anything to do with them, but I think that's a fair point to raise for the ICB in 2 months' time or 3 months' time, I know it is. So, yeah, far away.
Thank you. I was at the sharp end of all of this last week. 89-year-old father in accident and emergency for a whopping 10.5 hours. He was humiliated by the whole experience. But I do think that when you are in the eye of the storm, that you do realise the expectations that are put on the NHS. And I think that, from my perspective, I think for many people, there are unrealistic expectations, and a 10-hour shift in a waiting room at Warwick Hospital actually confirms that. So what I would ask you now is, how do you think that we should be educating the public to have more realistic expectations of the NHS and the frontline services that it's providing? Because if we were able to do that, I think that we wouldn't be in the situation of the grinding of teeth over the Ellen Badger at the moment. And I'm welcome to share with you the experience that I had offline, but now is not the point. So, but it wasn't an eye-opener. It was just simply, it is clear that the messaging is just not out there and expectations of that. So over to you. Thank you.
Wow, Councillor, that's an absolutely fantastic question. And I think probably if I had an answer to it and could give you a 30-second response, we would be in a very different place. But I guess a couple of things we say. The demand on urgent care services has been considerable. So over the past 5 years, Warwick's A&E has seen a 35% increase in attendances, which is phenomenal and way out of line with indeed the rest of the country and rest of Coventry and Warwickshire as a system. I think there are, and we do some things about public information, but I think there is probably more we can do, educating people about when to go to the GP and when not to go to A&E, or what conditions not to come to A&E with. We're using data a lot more in our planning. So, for example, we know that in the kind of May-June period, more people come to hospital with bee stings and bug bites. So we've been planning public information on our social media channels and on our website and elsewhere about how people can treat those conditions themselves, how they can go to chemists and pharmacists and so forth. But it's a huge ask, and I do think there's lots more we need to do in that area, and I'm really happy to have a conversation offline to talk about that. It'd be great.
Yeah, Councillor Johnston, please.
I just want to clarify the costs. I think you said the total costs so far have been 10.2 million. So the buildings that hadn't been constructed would have cost more than that. So I'm right that it's the, if you like, the current expenditure is the 10.2 million figure.
Yes, that's correct. I mean, I think one of the things we've all experienced during the last 5 years and since the business case was approved is a really significant increase in construction costs. And that's certainly what limited the GP practice having their own phase of that building. But yes, at the moment, 10.2 million is the cost.
Councillor Alcott, please.
Thank you, Chair. just about the services that you were listed, probably the most requested by GPs, by midwives, by every consultant are blood tests. Is it going to be phlebotomy clinics offered on site, or is it going to be a case of, say, someone going to see a midwife is then going to be sent over to Stratford for blood tests before they come back? Or my concern is that's quite difficult when you know you are pregnant, and it's difficult anyway. But I'm just a little bit concerned if you're not offering such a very basic service that almost every consultant will use in that building. It's putting people under unnecessary pressure and stress, and also the roads under a lot of pressure as well, because that could be quite a long trip coming up from the back end of Shipston all the way through to Stratford for a blood test that takes a minute.
I think there's an email exchange on this recently around phlebotomy services and blood tests. MDCU will offer some blood tests for certain patients coming through, but I believe that routine blood tests will still be offered from Stratford. But I wasn't part of that initial conversation, so I can take that away, pick up that email trail whether this was discussed, because I think there's a specific case study of someone coming in to a clinic and then having to go to Stratford. So I'll take that away and get clarity on that for you.
Councillor Ian Fradley, please. It's a good job you got somebody there who you're married to. Ian, yes.
Okay. From what the debate that's just been going on, do you have specific catchment areas north of you before it starts getting south of Stratford?
Sorry, could you clarify what you mean by that question, please?
Well, Shipston's here, Stratford's up there, you've got all this here. So if you take that's the river. If I'm living here, do I come that way or do I go that way for hospital services?
So for the range of clinics and services on offer at Ellen Badger, we're not setting a specific catchment area for clinics. That's additional capacity that we've got for this range of services. MDCU is an additional capacity to help with our urgent and emergency care pressures. So as our administrative teams are booking patients into clinics, into outpatient clinics, or as we're liaising with various referrers into our urgent services, be that WMUS, the ambulance provider, or primary care, we'd be looking at the demand and capacity on our services and where the best place for that patient to go is, but obviously with this population in mind.
Thank you.
Right, Councillor Passingham, I'll let you bring the questions to a close so you can have the last word. How about that then? But as long as it's relatively brief, please.
It's quite welcome. We are getting quite a lot of services now, but the people of Shipston are still very disappointed in that the services that were provided were taken away without any consultation for at least 3 years, and by the time the consultation was had, the building, the plans had gone on. So, but everyone was disappointed about it. Well, one of the services we used to have was minor injuries, and you were just talking about the accidents emergency in Warwick being 30% up. Are there other services like minor injuries that you could be bringing back that were originally in the community hospital, where we were getting completely integrated care, because some of the integrated care that we were getting is now being moved off to Warwick and Coventry?
Yeah, so minor injuries units in the traditional sense are not a mandated form of NHS care at the moment, and you've seen lots of those change over the last few years. I think medical day case unit, as Jack has described, is a really good example of how we can provide immediate medical kind of urgent care type interventions at the Shipston site. And as I said at the start, the site is designed to be flexible. We will continue to evolve it according to the demand that we see. And I think that the Ellen Badger site will have a long future and a growing future, providing care for residents of Shipston and beyond.
So if somebody had a bad cut and couldn't just put a plaster on it because it was bleeding too much, they would still have to go to Warwick, or could this medical daycare unit treat that?
No, so that's not the intention of the medical day case unit. At the moment, they'd have to go elsewhere, be it their GP or be it Warwick. A kind of cut like that wouldn't normally be an A&E type thing, but it depends on the nature.
Sorry, so where would you go for a bad cut that you couldn't stop the bleeding?
Well, so primary care offer some services that can support that. There are urgent care centres. There's obviously the urgent care centre here in Stratford that could provide that level of support. Ultimately, if it's a serious enough injury, then there is the A&E, but again, that's provided for accidents and emergencies.
Right then, I think we'll draw to a close now. We've been on a good while for about now, and Adam and Jack, I think, could do with a bit of a break. So thank you for coming. If there are questions, Councillor Locke, I know you mentioned about a case study. If there are things that, and the bit about the Lillington one, the added benefits, etc., of that, or unforeseen benefits that have emerged, that would be helpful as well. If you could also let us have the details of the consultation event, the open day, or whatever name you want to call it, that would be good, so we can promote it in our newsletters, and I'm sure it'll be able to be promoted on the council website if we speak nicely to Mr. Perks. So thank you very much for coming. Hope it wasn't too bad, and again, thank you for hosting us on the 8th of August when we came to the facility. So have a safe journey, and the coffee machine's just outside if you do want one before you go. And I'm proposing we have a 10-minute break, so we clear the room, we can stretch our legs, have a drink, and then be back at 11:25 to continue this wonderful agenda. Thank you. anticipated in the. Oh, somebody's phone's ringing. Good, thank you. Next item is, I think we might be reliant on Mr. Perks for this one.
Yes, there is.
And he's disappeared. Well, the next item on the agenda is the update and devolution in local government reorganisation that we agree to have at every meeting on the OSC. I think we have to do the submission by the 28th of November, I think it is. And I know there's a consultation that is running till, I believe it was this week. Yeah, it might be completing this week. And no, Mr.
Do you want me to give the update?
Mr. Perks has just come back whilst I was filling in. And thank you, Mr. Perks.
Thank you, Chairman. I understand that was practically seamless. Thank you. We're on the local government reorganisation item. Apologies for my delayed return. Yeah, we're currently underway in the process of preparing the council to make sure we've got all the information we need for the decision on the 17th of November about what we submit to government about our proposals for reorganising Warwickshire. We've got three work streams, major work streams going on at the moment. We've got some analysis work going on about the potential desegregation of county services, which is being led by a firm called People2. And they're away working on that, looking at what adult social care and the like would look like, how they would work in a two-unitary area or how it would compare to a single unitary. We've got a detailed business case being developed. We saw some outline work that Deloitte did. We've commissioned them to work that up into a detailed business case that will help inform the decision of council when we come to November. So that work is going on at the moment. I'll talk a little bit about some of the key dates and some member engagement with that as I go through the paper. And we've got, as Councillor Crump said, the public engagement exercise, which is ongoing at the moment, which is being led by a company called ORS, who are part of Swansea University. I'll talk a little bit about the engagement exercise as I go further down. So in terms of key dates and meetings, we've got the local government reorganisation working group, and they're the main member input to the formative stuff prior to taking it out to the wider membership. In terms of their workload, on Wednesday the 17th of September, there is a meeting with People2, who are looking at the disaggregation of county council services and how that might work. That's at 4 p.m. On Wednesday the 8th of October, we're going to present to that group some of the initial findings and the developing work from Deloitte on the business case, so that's a chance to get the input to that there. On the 22nd of October, there's a bit of a theme on a Wednesday at 4. ORS will have concluded the public engagement and the stakeholder consultation exercises by that time, so that session will focus on that input. And then that leaves the final session on the 29th of October, Wednesday at 4, where, based on the information that we've gathered from this analysis and the expert input we've got, that'll start to pull together the report that will go to Cabinet and then on to Council, which will inform the decision that we make about what we put to government as our proposal in November. So just a little bit more detail around those items. The public engagement exercise is currently underway. It started on the 7th of August and it runs to the 14th of September. There's a microsite which I'd encourage you to share with any of your constituents who might be interested in responding. It's quite a good little site. It shows what it's all about. It's quite concise, quite an easy read, puts things in layman's terms. I'll get Howard to share the link to that as part of the package. There are paper copies of the consultations available in the council office, so as people can see what's going on if they want to fill in a questionnaire, if they're not IT savvy or want to see something in paper. We've got those on our receptions. They're available in all of the district council offices around Warwickshire, including Rugby. ORS are going to do some focus groups to go alongside the questionnaire input as well to try and make sure we get a balanced feedback. There will be one residents focus group per district. There'll be a service users group, including those who use adult and children's services. That'll be one across the county. There'll be a focus group for voluntary and community sector groups, one for businesses, and 2 sessions for town and parish councils to try and sort of get their view. And there are in-depth interviews being carried out with sort of 15 identified key stakeholders, things like the police, the fire service and the MPs. So we're trying to gather a sort of really good sort of background sort of set of data to allow you to make an informed decision when we present to you in November. The final reports from Deloitte and ORS will be expected in mid-October, so they're working on those at the moment. They'll be informed by the stakeholder groups and the work going through there, but we'll have those in good time for the decision that we need to make as the year closes. There will be further updates to, oh no, that's the title of the paper, sorry, I won't read that out to you, on page 2. So just in summary then, the timetable for the consideration of the final report, so everybody knows what we're doing there. There will be an extraordinary meeting of Cabinet to consider that. The agenda for that will be published on the 31st of October, so that will be the first time we sort of go public with our proposals, depending on what they are, because we'll have to release papers for that. We're planning a briefing for all councillors, a full member briefing for the 4th of November. That date's still provisional, but that's the date we're aiming for at the moment, hoping that everything falls into place. And that will be based around what we've published on the 31st of October. There's an extraordinary meeting of this committee planned for the 5th of November. So after the member briefing, you'll have a chance to discuss that as a committee to make sure your views are fed back. Those will feed into an extraordinary meeting of the Cabinet on the 10th of November, where Cabinet will be making a recommendation to Council based on the evidence that they see. And that recommendation to Council will be considered at the extraordinary meeting of Council on the 17th of November, where we will be asking you to sort of know your colours to the mast, so to speak, and sort of pick what feedback you want to give to government. And the deadline for us making that submission is the 28th of November 2025. So that's a broad overview. Very happy to take any questions if anybody wants any more detail.
Councillor Rice, then Councillor Waller-Huggins, please.
Yes, I've only just become aware that the county engagement process finishes very soon, the next few days, which seems a little odd. So it begs the question, to what extent is the work of SDC and other district and borough councils being coordinated in any way at all with what's going on at county?
We have a data sharing arrangement so that we were basing our conclusions on a single version of the truth. We've got a data room which we've both sort of inputted data in. All of the districts have supplied the district related data and the county have supplied the county related data, and we've agreed the data set that we all want. So to that extent there's collaboration. I think it's fair to say that the political aspirations of the district and the county are likely to differ, so I suspect we will, I don't want to prejudge what you will conclude based on the data that's presented to you, but it seems that the county are heading towards a single unitary proposal. We've still got an open mind about whether it's a single or a 2 unitary proposal, and that'll be driven by the evidence. So that there is interaction, but I suspect we may be heading towards different suggestions.
Councillor Waller-Huggins, please.
Yes, I'm not confused really, but I'm trying very hard to log on and my computer's not having it. Within all of this, Tony, there is actually something going on the 10th and the 11th of September, isn't there? And at the moment, a consultation for the question asking. I wrote to you about it yesterday because the seats at the table are very limited on this, and Tony Bromwich and I have been asked to liaise with each other because there isn't a seat at the table for the reform councillor within this council, and there isn't a seat at the table predominantly just for the independents. That we're all being the 2 independents and the reform council are being asked to be of one voice, and that's impossible to do. So I don't see how you have, I'm sure it's an oversight, but you haven't mentioned that meeting, which is to do with devolution and the consultation process.
Yes, that isn't on my briefing sheet, but I will check whether there is a meeting on the 11th of September. I'm happy to talk to the membership of the group. It was decided by council, I believe, to set up a devolution and local government reorganisation working group, which has a membership which is politically balanced. There are seats for the administration, for the Conservative Party group, for the Green Party group in proportion to their membership of the council. Those are the only recognised groups within the council. The independent group have one seat on that, and the independent reform, because they're one group, there is a single seat for those two those sets of people. So that's where we are in terms of the constitution of the group. So we do need to resolve who will represent sort of the people who aren't in groups in that, the independents.
So I've written to you yesterday, what is that meeting to do with? I thought that that meeting is critical because that's the questions that are being asked of those that are conducting the sort of, if you like, the surveys and so forth. You know, I think that this is the North Warwickshire and the South Warwickshire scoping really for those, you know, and to preclude any political party, I think is we're all taking a very dim view of it, and advice has been taken. Thank you.
I'm not familiar exactly what's on the agenda for the 11th, but I'm happy to report that. I'll take that away and get back to you.
Help you. There are 10 places. There are 10 places for Warwickshire and Stratford. There are 2 sessions happening on, I believe, the 10th and the 11th. So there's 10 places on the 10th and there's 10 places on the 11th.
To be fair, I have responded to that. I've explained how the group was formed and what the membership criteria for that are, and the issue that we need to resolve between the independents, the 3 independents who need 1 seat on the group, and between them we need to work out who will represent them on that. So.
Can we take this off? Can you? I think we're going on. I'm going to take your point, Councillor Huggins. I think the rest of the committee are slightly nonplussed at times about this. It might be best if you and Mr. Perks discuss this outside the meeting?
Can do, but for the purpose of this meeting, I will never be referred to as an independent councillor. I represent Reform UK. Thank you.
Thank you.
Yeah, thanks, Chair. Councillor Rice picked up on an issue in respect to this questionnaire, and this morning I picked this up from the reception. When the first questionnaire came out, it came out from the 4 districts and boroughs. It was an ORS survey, which I completed. And I've been asked by residents in my ward about these questionnaires. Was there a separate questionnaire for Warwickshire County Council? How are the 2 fitting together? They hadn't actually seen anything from Warwickshire County Council. And I only saw something quite recently, to be honest. I was only made aware that they were having a parallel consultation exercise, the same as we are. Now, there's a bit of confusion, really, as to, you know, when you look at this form, whether or not the 2 are one, because it's the same organisation running the both. The deadlines are the same. People in my ward have only received notification that the Warwickshire consultation is just happening, but it's got the same deadline as the 14th of September. Doesn't give them a lot of time to respond. The other thing is, if you've got a copy of this, it's an awful lot easier to understand the background to it. Without that, when you go straight to the questionnaire, you don't have a lot of background, actually. So it's a bit of confusion out there at the moment as to how this is working together. Perhaps a bit further clarification for anybody watching.
Thank you. Yeah, in terms of taking your last point first, in terms of information, yes, the brochure gives you a good background. The microsite also sort of shares that, so I would encourage anybody to either get hold of the brochure or to use the microsite to make sure they know what they're answering. I'll have to get back to you on the details of the Warwickshire County Council consultation, because I was under the impression that had already closed, so I need to sort of check the details of that. It's David's been running the project rather than myself, so I'm slightly
it was closing on the 25th.
back on detail on that, so I don't want to misinform the committee, but I'm not yeah, I'm not absolutely certain who was running their consultation or the closure date, but I thought it was, I was aware it was a much shorter period of time, and it is a separate consultation from the one being done by the districts.
Yeah, I thought
But-
consultation was closing for the county one on the 25th.
Thanks. Then all I would say, and it's a county matter, it's not a matter for Stratford District Council, but what I would say is that the notification or the communication of that survey was, in my residence size, poorly managed, poorly handled.
Yeah, so
They weren't aware of it.
I think your district county councillor was aware of it. Obviously, with my twin hat on, we were made aware of it, and we were given social media contacts, etc., to publicise it. And I publicised it in my weekly one for several weeks running. So whoever is your county councillor, they might not have been as diligent as myself, shall we say, and I'll
Or not as aware. Simply that.
Well, not as aware as myself. Yeah, I'll take that as a compliment, Keithy, so thank you for that. Yeah, I've just got one final question on this. Nobody else wants to come in on this. I've got one. Councillor Rolfe, and then I'll...
Very, very quickly, I am a Warwickshire County Councillor, and I saw the Warwickshire County Council consultation on Facebook. I have never been notified as a Warwickshire County Councillor. I don't know if anybody else has.
Yes, I think you were, Councillor Rolfe, because it was in the communication from Jane Sermon and probably Paul Cox as well, your weekly update for your social media. It was mentioned in there several times because I used it.
Okay.
Councillor Huggins, quickly.
Yeah, I'm just a bit shocked that the Lib Dems have got no recollection of this survey from Warwickshire, because aren't you in opposition at Warwickshire? So there you go.
Right then, and I will end the matter. Hopefully it's a relevant question, and it is probably, I think Councillor Johnston might allude to this as well, because he's in charge of employment. It's just about the, obviously, short time scales, lots of work, etc. I'm concerned about staff capacity and well-being in trying to complete this with other competing demands. So if we could have some reassurance that the staff are getting the help and the support and resources to complete the work on this, that would be great. Thank you.
Yes, we are having to reallocate resource to this. We haven't been provided any additional resource for sort of carrying this out, so we are reprioritising people's duties to make sure that the essential work gets covered, and that we sort of move forward and give you the best chance to make the right decision on this. But we are aware that some things will have to be sort of scaled back because of it, and we're managing that as part of our general workload management.
Right then, thank you for that. I think we can draw a close to that. Item number 9 are the minutes of the climate change panel meeting on pages 19. Oh, no, I was trying to move on too quickly. Glad Tony was there to spot the deliberate mistake, and I wondered who was going to spot it first. So well done, Tony. Item number 8 is the Task and Finish Group privately managed public spaces on pages 9 to 18. We're to agree the scope, membership and terms of reference to the Task and Finish Group privately managed public spaces. Right, she's on page 9 to 18. Harry, do you want to just give us a kick-off on that one, please?
Yes, thanks, Chair. Just to quickly introduce the item, you're all aware I've been sending emails about the information we were gathering. Initially, we've been asking members to supply information about private management companies operating within their wards, and there's a spreadsheet to fill out, so please continue to send me any information as you that you have. We've asked members to volunteer. The membership of the group, as per the terms of reference, needs to be politically balanced, and the members that have put themselves forward and been confirmed are as follows. We have Councillor Pemberton, Councillor Crump, Councillor Passingham, Councillor Johnston, Councillor Petrovic, Councillor Littlewood, Councillor Bromwich, Councillor Brown, Councillor Hedger-Seraphin, Councillor Rolfe and Councillor Jenny Fradgley. We've got officers, from planning, from legal, and from parish and town council liaison and green spaces supporting the group. And the first meeting of the group is provisionally scheduled for next Wednesday, the 3rd of September at 10 a.m. As per the terms of reference, again, members are entitled to send substitutes to any meetings they can't attend. As you'll all be aware from the council debate and the notice of motion, the timescales are quite short on this, so we're quite keen to get underway with the work, hold the meetings regularly. The scoping document suggests that we hold meetings fortnightly. Ad hoc meetings might be scheduled as well, so they might be even more frequent than that, but as you'll all be aware, we've got 3 months basically to get the work done. Happy to take any questions from members. Thank you.
Again, we'll be doing hybrid meetings as well for people to attend online if they're not able to get here. Yep. So, yeah. Any comments from members? I think that was a comprehensive update from Howard, self-explanatory, emphasis on timescale, 2 weekly meetings, because we have to produce something to OC in November, wasn't it, Howard? For it to go to Cabinet in December. Yeah. Any comments? People happy? I'll take the point about substitutes, which is fine. Councillor Johnson, you can come in, please.
I just don't think that an indicator of success should be a change in national legislation. We have no way of controlling that. That is totally out of our hands.
I think probably on that point is that basically we can put comments to the relevant ministries in the hope that they do amend or change the legislation.
It's an aspiration.
Yes, it is an aspiration.
Yeah.
An indicator of success. But we shouldn't fail by failing to achieve this by the December, can you say?
Yeah. Councillor Huggins, please. Yeah.
Yeah, so if you go to page 20 then, to the HVO update, I wonder if we could have some clarity, please, on the no virgin palm oil was used, because...
Oh, sorry, we're still... no, I made a mistake.
What?
That I went on to that item on the agenda first.
Oh, all right then.
And I missed off the task and finish group. So we're just finishing off the task and finish group, then we'll go on to the climate change panel. Is that all right? I'm sure we're... yeah? Are we okay on the on the public space? So hold that thought, Councillor Wally Huggins. Any other comments? Are members happy with that? Good. Thank you. So, members, members are happy with that, Howard. Now we can. It was my mistake, and I'll hold my hand up. It was me. I do admit it. Which is unusual for me to make my mistakes, but the next item is item 9, minutes from the climate change panel. Councillor Wally Huggins, I do believe you want to come in on this one.
Yes, I'd like... there is still ambiguity regarding HVO, and the update on point 99 confirms this with a statement that no virgin palm oil was used. The semantics around this are just ridiculous now. No virgin palm oil was used, but therefore was processed palm oil used? That is the question now around this. And I also say that I raise the point that, of course, Warwick and Leamington, who some of the colleagues around this table are wanting to join with to run at South Warwickshire Council, they've rejected the use of HVO because of the impossibility of guaranteeing that palm oil is not used within HVO. So I would like some clarity, please, on what precisely they mean by no virgin palm oil, because it could mean, in fact, that processed palm oil is used. I believe this was queried at the time and there was no answer. And yet again, this can is being kicked down the road. Thank you.
Yeah, I was at that meeting, Councillor Wally Huggins, and then these questions were raised. I know that Julie Lewis was still waiting for some answers from Certas or Biffa. I can't remember which one of the two. I don't know whether you'll be able to help me on that, Tony, to come back with some answers to the questions that they hadn't answered. And are you happy to come back on raising that question? With them?
Yeah, Biffa are the supplier. They use fuel that is certified by Certas as being compliant with the renewable transport fuel obligation, which was the decision of council that we would use fuel that complied with that. Certas are the independent verifier of that. We have, I understand, recently received some further information from Certas, which I can share. But yes, it would be Certas that would be certifying it, not BIFA, because BIFA are the supplier, Certas are the certifying body. So I think that's the point you wanted me to clarify.
So apart from that, sorry, I didn't realise you.
So the question then is, are Certas guaranteeing that there is no palm oil, either virgin or otherwise, in the HVO that they are supplying to BIFA in their trucks? Are those words used? We guarantee that it is not used.
Point of clarification, please, Chair.
Carry on.
Thank you. Can I just quote, because this is here to note the minutes. If there's an issue with the minutes, shouldn't it be a question to the panel? This querying the minutes themselves is one thing, but this seems to be a bit more in depth, and I'm just wondering if the best forum is to go to the panel directly and ask the question.
Yeah. Yeah, I think I've just taken some advice that we can ask the climate change panel to clarify all those points or raise that question with the organisation and get something officially in the minutes to do that. So if members are happy, as part of this minutes, that we ask the climate change panel to clarify the points that Councillor Wally Hoggins and anybody else has raised about those minutes, then we should get an official answer back. But there's a member of the committee. Has raised a point. Councillor Gist, please. If you want to come forward and if you've got a point of clarification to help the situation, I'm more than happy if you can come forward then, please. But I'd rather you come through the chair rather than direct to members of the committee, please.
I would have thought if it's to note the minutes and there's a query, only people surely in the meeting can query the minutes. And if you have a question as to what was discussed at the climate change panel, then they do need to be raised.
No, I don't think that's correct. The people in the minutes.
Oh, is there an issue with the accuracy of the minutes? Because on the agenda item, it's to note the minutes. So
I think the issue is. Yeah, I think the issue is. Let's get the minutes up. If you just. We'll just have a slight adjournment just to clarify something. Thank you. way forward. The option is that if this committee feels they can want to ask a question or raise a point at Cabinet on Monday regarding the climate change panel and the particular part about virgin palm oil, I can raise that as part of the update from as chair of OSC to the Cabinet meeting. Obviously, I would need a mandate to a proposer and a seconder that we raise the question at Cabinet, and then we'll be able to do so. Councillor Ross, do you want to come in, please?
Surely the easiest way to deal with this is for us as a committee to propose the minutes and second the minutes, which is what we're asked to do here, and that Councillor Wally Hoggins asked the question of the climate panel, because it's her that wants the answer to that question, not the rest of us.
Do you want to come in, please?
Well, I was just going to say that the agenda says we're noting the minutes. It doesn't say that we are considering them. We're not approving them. We're simply noting them.
Chair, I have an issue that if you noted it, you've still got to look at them to see whether they're accurate or not. I mean, if you're noting them and you're not going to make any decision on them, you can also not look at them.
You can't say whether they're accurate because nobody was there.
Well, I was.
Yeah, but that...
I don't think it's an issue for this committee to ask a question on a point in minutes that has come before it.
Yeah. Councillor Hoggins, then I'll come back again.
Yeah, I'm a little bit concerned here because it seems to be, only she wants to raise this issue. The point is that, this is coming before Overview and Scrutiny Committee. We've read the minutes, that's what we're supposed to do. And I've raised a question for it, which I thought was my remit, and that's why it came to Overview and Scrutiny Committee. So if, however, my Lib Dem colleagues are saying that they don't want to scrutinise the terminology of no virgin palm oil at all, that you're just accepting the status quo, then you need to think about that really carefully, because I am scrutinising this, I am looking at it, and I'm still seeking reassurances. You'll recall I'm still not happy about it, and as an individual I can still raise this at full Cabinet on Monday anyway. I can request to speak on it. But the point is that we're not here as a rubber stamping. We are looking at this, and there is ambiguity within this. And we are a disservice to our public and the money that's being spent on this by not doing so. Otherwise, there is no point having this coming before Overview and Scrutiny Committee. This isn't news to you about the virgin palm oil, and the point that I raised about the proposed amalgamation with Warwick and Leamington is very serious. They rejected this themselves because there was no guarantees. This is a matter. It's important and it's serious. And just trying to fob me off again as, it's just her again. No, this matters. It matters. It matters for climate change across the world.
I've got Councillor Frodgley and then Councillor Keithley.
I was at this committee. This was actually raised at the committee, and there wasn't an answer to it there and then. And Julie was actually asked to come back at the next climate change meeting to clarify points raised around this use of fuel.
Yeah, so that was my understanding as well. I was at that meeting as
So
well.
really we're waiting for the next climate change, which I think is quite soon. It's the 2nd of September, when this should come back for clarification.
Let's have a quick look on the next. Tuesday the 2nd, yeah. Yeah, I think Howard's got the date. Councillor Keithley, do you want to come in, please?
Yeah, thanks. The point I made a minute ago, to clarify, was that we are noting these minutes. We're not approving them. They're not ours to approve. All right? I do take exception to what Councillor Wally Hoggins said, because I don't think we're suggesting we shouldn't scrutinise this, because that's why they're in front of us. And a fair question has been raised about clarification on this particular point. So the issue is, how do you take that question back? That's all it is, simply that.
There's two options. One, I know we're waiting for an update from climate change, but I don't think it's an issue you taking this point to Cabinet as part of your chair's brief on Monday.
Yeah.
On behalf of the committee, just to clarify the point.
Yeah, like I say, the advice I've been taking, there isn't an issue with raising this point, is the update from OSC at the committee, at Cabinet on Monday, for the climate change panel, then to, obviously they will see the feedback or hear the feedback. I'll be with you in a minute. Do you want to come back in again, do you say? Yeah, we'll be back in a sec. I thought it indicated. So therefore, they note our concerns, or note the points about some clarity around this. It's not concerns, it's clarity, isn't it? I think that's the right word. And then when the climate change meets in October, you say the 4th, Howard, was it? 2nd of September? Oh, next week. I better put that in my diary quick. They will be aware of the need for clarity that OSC has asked for, which OSC can ask for, and then it should be covered as part of that meeting. So I think that is probably the most sensible way forward. And are we happy with that? Howard, if you come up with some form of words that we sort of couldn't agree, I think that's probably the most pragmatic way forward. And then if we're not happy in the next lot of minutes from the climate change panel, we will then have to have a more in-depth debate. So I think I'm trying not to push it down the road. I'm trying to be seek clarification, and then I think between now and then, if there's still not a resolution of this, we can have some more time thinking about how we deal with this, rather than just doing ad hoc, do it in a considered way. Councillor Wildhagen, please.
Yeah, I think we do need to go back to what's just happened within this room, all right? And what just happened there was that, oh no, you're just supposed to rubber stamp this and say approve on or acknowledge it, and I'm fed up about it. And pardon,
Mike,
what did you just say?
Councillor Rice, please. Can we
that
just
was
not,
offensive.
Could you
this
withdraw
is
that comment,
outrageous.
please? Thank you. Yes, okay. I was going to say temperatures are running hot. That's probably not the right analogy on this one. I think we've got a way forward. I think that we do need to obviously calm heads on this, and let's just stay calm on this. I think we've got a first step forward and see how that goes, and then if that isn't practical, doesn't work as well as it should have done, we can then spend some time considering how we do this forward. So I think we've got a way forward, and I'll let Councillor Passingham have the last word on this. If you put your microphone on, please.
Sorry, I was accepting the point there that was made that we can ask for clarification on these minutes, and I've got another clarification that I'd like on the minutes of the climate change panel. Can I raise that?
Yeah, that's fine.
The report on the climate scorecard says we are now second highest scoring council in Warwickshire, and I noticed in one of the reports from the council in the view, I think it's Council News, it was saying that we now the district council manages a third of its land for nature, and since I've been on the council, I haven't noticed any change in the way the land has been managed. I put a motion to the full council asking for there to be an ecological emergency report, which was passed unanimously, in which it was said we should do an ecological management plan and actually say how we were going to manage a third of the land for nature. But there's no clarification at all. It's a broader question than that, in a way, in that the scorecard answers we need evidence for them, and I don't know of any evidence specifically for that point. How is the land being managed for nature?
Yeah, and again, I think, again, it's a fair point, scrutinise it. What's the basis of the evidence when we're producing this information that's going to go on the website, and other organisations will judge us on how well or how poorly we are performing. So I think that, again, is another thing to consider for note, and the Climate Change Panel could potentially say, oh, we have provided this evidence. So I think probably the information is there, and this is no criticism of whoever produced the minutes, Howard, for the Climate Change Panel, by the way, so you won't throw anything at me. I think that the point is that if their evidence is already there in the minutes, it stops us asking questions here and makes our life a lot easier. So if there is some form of evidence, but I think, yeah, it's just like you've done your homework, and then please can you show your workings? Yeah. So if you, I'm more than happy again. I think that's a sensible conversation. So I think we've got a way forward. Councillor Guest, I know you wanted to come forward. I think if you could note what we've raised at the meeting, and then if you could potentially address those at the Cabinet when I raise these points at the Cabinet meeting. If you want to come forward, yeah, Brit.
Councillor Guest.
You need to deal with it.
I just want to say I've got no issue at all with the questions being raised. I just want it to be raised via the right route. So thank you for, I think we found a way, so thank you.
Brilliant. Yeah, thank you. Right, there's an issue I will address that issue that you've just raised. So I'll potentially not now, but I will address this. So yeah, don't worry about that. So I think we've got a way forward. This took slightly longer than I thought on this item, so I do apologise for that.
So the noting the minutes, subject to those two matters that were raised to Cabinet.
Yeah, so we're happy with noting the 2 minutes, minutes subject to the two matters we're going to raise at Cabinet on Monday. Right then, item 10, Cabinet meeting 1st of September. The affordable, we've got 3 items we're going to be looking at. The first 2 items, the Affordable Housing Standing Advice Note and the Performance Monitoring Report for quarter 1, we will do. But the 3rd item, we will have to go into confidential. Yeah. Okay. So the first item is the Affordable Housing Standing Advice Note. And if you... Yeah. Thank you, Tony.
Thank you, Chair. Just by way of a brief introduction to this, the Affordable Housing Standing Advice Note is a document that we produced. John Gordon, our Development Enabling Officer, has pulled it together. It doesn't set out any sort of new policy, but the idea is it gathers together the various strands of our housing policy into a single document with a view to making it easier for sort of people trying to develop in the district to understand what the requirements are to improve our delivery of sort of affordable housing. The note is attached. I'm not the world's expert on it, but I'm reasonably familiar with the document if anybody's got any questions on it.
And shall I open the button while members are thinking some questions to come in? Or does anybody want to come in straight away? Right, I'll come in, Tony. Yeah, I think it's sensible that we're bringing all the strands together and to make it as easy as possible to look at all the options around about affordable housing. Is this an idea that you've come up with, or are other councils come up with something similar and we're trying to adapt some of those principles, or how did the proposal come about to provide this affordable housing standing advice note?
My understanding is it came from the housing team to try and sort of draw together stuff to make it easier to implement sort of the policies that the council has set out.
Brilliant. And again, we talked about a previous one, changing national policy. I don't suppose we're about to change national policy as one of the items of success, measures of success in this one. Any items measure success? How do you think this will help? How this has made a positive difference to our district, please?
Again, I think it's just one of sort of simplicity. When the informations and objectives are all in one place, it's easier for our partners who are trying to deliver development to understand what we're trying to achieve. We've got a clearer agenda, clearer objectives, and we should see that in improved delivery of sort of affordable housing to suit the needs that we have at the district. We've got a lot of housing needs within the district, and it's a step in the right direction to try and meet those. It's not a panacea, but I think it's a useful document to move things on.
So you think we'll probably get a better quality, potentially a better quality applications, and potentially a speedier, help the speed of the processing?
Yeah, I think that will be one of the key benefits, that we're looking for a smooth process through sort of planning. It's a complicated process. So if we can get applications that address the key issues in an acceptable form, it's much easier for the committees to make a decision on those. If we've got all the stuff sort of served up to us in a timely manner, we can help delivering the housing that the district needs.
Thank you, Chair, and thank you for the work that's gone into this. It is excellent, no doubt about it. Can I just ask, I know that Stratford Town Council and other parish councils around the area are currently updating neighbourhood plans. This is a vital document for them that I do believe needs to be shared, because the housing survey, specialist housing, is exactly what is needed at this moment in time for anyone updating neighbourhood plans. Because I do believe it has changed, and it's changed quite significantly from when the last time it was done. So to make sure that everybody in the district can work to the same frame, to the same idea, it would be very helpful if that could be passed around to all parish councils, please.
Yeah, I can arrange for the parish liaison officer, assuming this gets the blessing of Cabinet on Monday, to circulate that to all parishes.
Councillor Rice, please.
Thank you. I'm just wondering about the lifetime of this document. How is it being taken forward into the South Warwickshire local plan, in particular, given the government's ideas about green belt and affordable housing?
Okay. As I think I said in my introduction, this document doesn't set policy, it reflects policy. So the South Warwickshire local plan is a statutory process that we will go through, and that will form whatever view it does about sort of green belts and housing numbers and allocations. As and when that emerges, that will feed into a revised version of this, which is, I think in the report it describes it as a living document. It's a document that will have to change to reflect sort of policy changes both within the local plan and sort of within more housing policy sort of more broadly. But it will be hopefully a definitive source to which people can refer to get the most contemporary information.
Oh, do you like
So, sorry.
Carry on. Yep.
So the answer is possibly a short lifetime then?
Yes, it's a document that will change to reflect changes in policy. So, yeah, if the local plan changes the outlook significantly, we will update this to reflect that. So, yes, potentially short, but certainly varied.
Councillor Johnston, please.
Just looking at the options available to the Cabinet, I think we should welcome the Cabinet approving this document. I think we're going to face a situation where most of what we're doing has a relatively short lifespan. Hopefully, whichever council structure replaces us will adopt something similar going forward, as the South Warwickshire local plan is in much the same position.
Yes, I think that would be sensible, and that's something we'll have to pick up as we sort of look about the transitional arrangements as we move to whatever setup that we get as and when sort of local government is reorganised. But I think it's a very valid point, Councillor Johnson.
Thank you. Any other questions on that one? No, I think that one's gone quite swimmingly, so we'll move on. I did like the analogy that the housing was a living document, so well done, Mr. Perks. You've been sitting next to me too long. So the next one. Simon, performance monitoring report for Q1. So what Simon doesn't know about this isn't worth knowing. Just build you up there, Simon. Just again the usual brief update of what you've, the pain and stresses you've gone through to produce this report for us.
Thank you, Chair. This is the Q1 performance monitoring report for 25-26 and looks at the high-level report on the delivery of the council plan actions and the key performance indicators. As you'll see in the report, that there are 62 actions in the plan for year 2, of which obviously it's a very quiet quarter, and 56 of the 62 aren't actually reported in this period. They're obviously at the end of the year or either ongoing later on in the year. 5 have been achieved and 1 was not achieved. That was the My District portal that hasn't been set up yet correctly. And then of the 28 key performance indicators that are monitoring performance in year 2, 3 of them are reported annually, and of the remaining 25, 18 have reached their target for the end of Q1, and 7 have failed to reach their target. And it's now over to the committee to make any comments, please.
Brilliant. Who wants to go in on this one then? Or shall I start and then you come in? Councillor Johnson, you got your hand up there. Well done. You shouldn't have done that so quickly.
By accident, really. It's just some questions on some of the items. One is the on page 23 of the Cabinet Papers, the feasibility study for the hydroelectric turbine. It said that it should be presented to Cabinet September 2025. We're in September 2025. Does that mean the next Cabinet meeting, so it'll come to the next agenda here?
I'll answer that one if you like to save Simon, because the poor chap doesn't know the answer. We were all lined up to bring that to the September version of Cabinet. We took it to the Cabinet Forum, and they've asked me to do some sort of further exploration to make sure that we're checking that we're doing the right thing. So we've deferred that item till October. But the report, when Simon produced this report, we were still planning to come to September, so we were on target. It was deferred to allow some sort of further research to be carried out, but we will bring it to October, and you'd be very welcome to scrutinise it prior to it going there.
I look forward to it. My second question is on page 27, which is the work concerning the route options for a bypass for Stratford-on-Avon, which is timetable for March 2026. Is that compatible with the timescale for the South Warwickshire local plan?
Do you want me to do that one as well?
Yeah, please, yeah.
Yes, the two things are hand in glove, because it will be an essential factor in working out what development we can place south of Stratford. That is being worked on at the moment by Atkins Realis. They're looking at a long list of routes, and then the preferred route will be taken forward to a costing option. We're well on with the first phase of the work, and John Careford will tell you exactly when it's reporting, but I've definitely seen sort of quite advanced drafts of that.
Just tied on to that one, would the costing options include any possible sources of funding for that?
The Councillor Couch is nodding frantically at the back, so yes.
Thank you. Right, whilst we're waiting for other questions, I've got 1 or 2. Let's see from the start. CP1A, I was thinking Star Wars, like page 19. CP30 and whatever. The View magazine, 2 editions to be published during the year. We are expecting the first publication before the end of the calendar year, so that's before the end of December. Just when the second edition will be published, and would potentially the second edition have information regarding about local government reorganisation? Just feedback from. It might not be practical, we might not have anything back, but there might be one item, something that we could potentially consider in that viewing magazine in being open and transparent and that. So just a couple of thoughts on that one.
Yes, I understand we're on target to produce the first edition by the end of the year. Helene is at the back nodding, so that's always encouraging. And yes, your suggestion of the topic of local government organisation seems eminently sensible. I don't think we've got as far as scoping the contents of the second edition yet, but we'll take that forward.
Or shall I carry on until there's some more? I've got a few. Let's have a quick look. Page 21, CP2A. Again, improve access to council services to those throughout the district. The first one, the screening programme, no problem at all, great, whatever, and really supportive of this. I've just wondered how this comes into access to council services, because yes, we're having them at council locations, but the services we're providing, they're going to go into the NHS or potential system. So it's just pedant here. I've got, totally supportive of the initiative, so no problem. But I just wondered about that, please.
I think it's a matter of semantics, really. The council were keen that we sort of provided some funding to deliver this programme, and we were just wanted to sort of give assurance that the council's wishes were being reflected and we were actually delivering it. So whether it's in quite the right spot, I think it's probably one for Simon, but we probably couldn't think of anywhere better to put it, Chairman, to be honest.
Councillor Keithley, please.
Yeah, thanks, Chair. I think it's more to do with the fact that we've actually held these screening programmes across the district this time. So we've not just done a programme in Stratford, we've taken it out to Southam, we've got Studley, Ulster's been done, and we've got Henley and Shipston planned. So we're just making sure that it's more accessible for residents of the district.
Yeah, I'm totally supportive, 100%. I've got no issue with it. It would just seem to be, it probably, as Mr. Perks says, we couldn't find a right category to put it in, and we put it in that one. So the explanation is there. So yeah, I've got no issue with that whatsoever. It's just a point. Councillor Wall-Huggins, please.
Yeah, again, we come back to KPIs, please, to do with the Home Choice Plus and basically those two matters, that they're off target. The target was 75% of the percentage of Home Choice Plus applications assessed and applicants notified of a decision within 10 days. The target was 75%, and we've achieved 8%. What are we doing about this? This is bread and butter stuff, really. I'm sure you were expecting that question. This matters. It really matters, and it keeps on coming up at Overview and Scrutiny Committee, and it matters to each and every one of our residents as well. And I'm just sad that we just don't seem to be able to get this over the line for some of the most vulnerable people who, are actually just existing within our society, local society. Please, can we have an answer?
Hi, Hannah.
So you'll be aware that at the last meeting of this committee, we talked about the plans to sort of refresh the system. We've effectively got an archaic IT system that isn't supporting the efficient delivery. So we brought forward a series of actions and activities that are going to overhaul this, but it actually is likely to get worse before it gets better, because the KPI in many ways is driving the wrong behaviours. What you don't see with that KPI is the historic backlog that there is. We just see those that come in within that period and whether they are assessed within that 10-day period, and then whether they're activated in terms of the second KPI. So this KPI is going to be poor. There isn't going to be anything that we can do, because even if we were to double the size of the team, which isn't feasible and it's not pragmatic, it would still take us sort of around 3 months to train new staff members. So we're putting in additional resource, we're tackling the issue of the system, we're looking at our processes, we're doing that whole scale piece of work. And absolutely the drivers for that is because we recognise that this isn't the right service for our residents, and that we recognise that housing issues are really challenging for people, but we do need that period of time to be able to implement those changes.
Follow up? Yep.
Yeah, I wonder therefore is, because these are stark figures and this is what people are going to look at and see for the council, I wonder therefore, and I know you come to other committees as well, I wonder if we need to have a time frame for when we can expect this to improve. And the reason why I think there's this urgency about this is because we're about to start into the colder months, aren't we? We're going from the lovely, my husband keeps telling me, I've been saying all summer, it's so hot. We're going to be going to, it's so cold. And then we have the all-in, categories as well we need to deal with. So I want to know, as a councillor, how we're going to get a better oversight of what's being done to rectify this situation. Thank you. And how we go about that reporting to us. And I'm not trying to cause trouble, and I don't want to detract from it, but this really matters. Thank you.
I guess there's a couple of alternatives. So there's certainly a scheduled item to come back to scrutiny, I believe, in March, but I anticipate that you want something sooner than that. So there's a link with the Housing Associations Working Group. We could bring a timeline through to there, or back to a future meeting of this group. Either of those are feasible. We've got that timeline. We're working through sort of the recruitment's underway. You'll have all received an email yesterday to say that that refresh of the register, that letter has gone out to those applicants who are on the housing register but haven't bid for a significant period of time. And we're also making quite a lot of sort of short, sharp changes to around the sort of the process and the timeliness, because one of the things that happens is we've got a huge pile of pending applications where people make an application, the team process it, and we'll go back and say, you know, you've not provided identification, or there's nothing that supports the medical need that you're relying on, and then that can sit there for 4 to 6 months whilst we're waiting for somebody to come back to us. And I would say that actually that person probably isn't in urgent housing need, and so we're going to look at the different sets of processes around how actually we can give somebody a time frame to come back to us. Of course there may be exceptions, but that actually that if that person doesn't come back to us in that time frame and there's no good reason not to, that then is just closed, and that we haven't got a team that sort of feel that, because everybody that works in housing does it because they care. You can imagine that the team don't feel very good when they've got this backlog, so we need to also look at how we can sift through some of that. So there's the two options in terms of where that could come back in terms of a bit more of a detailed discussion around the timeline.
Thank you for that. Right, I've got some more. Any other questions before I come back in again? Yeah, might be you, Tony, on this one again. And obviously Hannah's here as well. CP2A, page 21, improved digital offering for customers, council tax benefits. The project has been put on pause due to vacancies across the team and change in services. The priorities are being reassessed, and a new time frame for completion of this work will be set. So it'd be interesting to see when that time scale is, and it sort of like links in with CP2B to improve the effectiveness of the council through innovation. And the digital strategy implementation has been is being reassessed. So is the issue regarding vacancies in housing review and customer services, or is the issue to do with vacancies in the digital team to help you go forward?
So the revenues manager is retiring, so that's a fairly critical role within the revenue structure. So it's purely related to that, and then sort of us looking at how we best sort of ready that team, because we've got quite a significant succession risk within the revenues team. We've got a number of very experienced post holders that have held their posts for a significant amount of time, and we have, due to a number of retirements, lost an awful lot of corporate knowledge within that team. So we're really thinking about that structure and how we build in some resilience. There's a separate issue in relation to this particular issue, in that the council website, we get really good feedback in relation to that. The interface with the part of it where you can go on and look at your council tax bill is not great, and at the moment it's a 10-page PDF that somebody would need to follow through to look at it. So clearly we need to improve that, but we're working through some issues with the system provider, so we aren't prepared to invest the council's money in buying the solution from them until we're confident that it's actually going to be the right outcome for the resident. So it's a combination of those factors.
Is it like do you think any time scale? Obviously, we're now in late August. Do you think it will be achieved by the end of the financial year, or this target's not likely to be met?
That's my ambition, is that this would be achieved by the end of the financial year, but we are midway through our discussions with the system provider.
Brilliant. Questions? I've got one more, and I think we'll move on. Well, two. One relates to CP2D, to do with the trees. Again, no issue with this. I'm being brought up in the country. I can't get enough trees. I think they're good. Again, it'd be interesting to see the target of planting trees by saying so. I'd just like some reassurance whether those trees have had some supportive packaging for several years to ensure they are established and are able to deal with particular conditions around waste, about drought, etc. Because it's no good giving councils £50,000 for tree and for tree planting. They get planted, then 2 years later they're no longer living, or they're in a poor state. Having had HS2 allegedly do something similar near me, notice the word allegedly, I don't want us to do that. So perhaps some reassurance about that. It probably is in there, but I think that is...
Yeah, trees are, as you say, a challenge. They're very easy to say, well, plant trees, quite difficult to implement. The way that we're attacking that is to try and sort of plant them through partner organisations who've got a long-term interest in the land. The initiative we've had quite a lot of success with the free trees for farmers, because the other thing is you get the right tree in the right place and some certainty that it's going to continue. So we're continuing funding for that. It's a slightly more expensive way of providing the trees than just sort of giving them out randomly, but it does at least hopefully ensure that trees, they're capturing carbon for the medium to long term. We've expanded that this year to a sort of what the Wilder Communities project, which works with sort of public open spaces of local councils, local community groups who've got long-term interests in land and the ability to support these trees when they're in place. So we're doing what we can to sort of pick up that agenda in terms of reassurance. That does sometimes make it look like we haven't planted many trees, but I'd rather plant them and keep them than plant more and know they're all going to die.
So you've done a root and branch exercise on that one, Tony. So thank you for that one. And the final one, come on, you didn't have to smile at that one. Hannah's touched on it. We mentioned in the housing head of service changes and officers' retirements, and I think there's one further down to do with housing policy and development team leader and housing strategy officers. Again, I know I'm probably coming on to Councillor Johnston's area about staff vacancies, succession risk, and the impact of local government reorganisation, and obviously the work of saying around local government reorganisation, how it could potentially impact on our performance framework. And again, we need to sort of like monitor that as well. Do you want to come in, Councillor Johnston, please?
I can assure you the Employment Committee has this in hand, and we'll be taking that forward with some vigour.
Brilliant, thank you. Any points to Mr. Perks?
No, I think the points you raise are valid. It's a challenging sort of employment environment out there. The uncertainty that is only going to increase around the local government reorganisation as we get further down the line will make it more challenging to recruit people. We're sort of live to those issues and doing what we can to sort of manage and mitigate them and using resources available. Sometimes that means we're having to use more agency people than we need to, but the important thing is we get the work done that the public need doing, and we're trying to sort of focus that that gets achieved.
Thank you. I always like that when you say the points I've raised are valid, Mr. Perk, so thank you for that. And I've got Howard to minute that double underlined in bold, so they will be available for the next time we look at them. Our next item is to do with the Gateway site, Stratford-on-Avon. Yes, I'd just like to have an adjournment for 2 minutes just to cover a couple of issues. So just adjourn now for 2 minutes. Thank you. Right, thank you for that. Obviously, some complex issues that we've slightly had to try and resolve before we moved on to this item on the agenda. And because of the length of the meeting, the first item we have to discuss is we're going to go past the 3 hours. So therefore, please, would members agree that I'm proposing that we agree to go past the 3 hours. All those in favour? Thank you for that. Mr. Perks, before we move on to this item, you've got a statement, please.
Just for the sake of probity, because I was involved in negotiating the land deal with the companies who were being discussed here, I've had no involvement with the business rates side of things, but for the sake, for appearance's sake, I'm going to withdraw for this item, and I'll leave you in the hands of the Deputy Monitoring Officers.
And just so members are still on the same paper, this is the Gateway site, Stratford-upon-Avon business. You'll bear with us for 2 seconds, Councillor Johnson. Everything will become clear.
Okay, so you're going to answer the confidential and ask people to leave the room, yes?
Yes, Hannah's got it all covered. So, but thank you for reminding me, because sometimes that reminder will be very pertinent. So that was very helpful, and I'll take that as a friendly amendment, friendly intervention. So thank you for that. So it is item 15 on the Cabinet papers. The Gateway business rates on pages, and obviously the people have seen the blue papers. So Hannah, over to you, please.
Okay, so if I address the sort of the open part of the report first. So obviously this centres around the Gateway, which is a key strategic site for the council, and this.
Wait, yeah, we are just. Yeah. Business right, that bit there. Consider. Yeah. So you're at the moment talking to pages 153 to 158 of the open part of the Cabinet papers, aren't you?
Yes, that's correct.
Yep, we were just making sure we were clear. Yep, just making sure, because it's, Kate, it's in 2 parts. There's a bit in page 153 to 158, and then the other part. Yes, we are tiptoeing about this very carefully. So, again, thank you, just making sure we're all.
Just a point of order. For the sake of clarity, isn't it easier to just call this confidential now? Because in case we veer into things that are confidential.
Hannah's going to cover that.
Okay, right.
Thank you.
Okay.
So my introduction is literally 3 sentences that talks about the Gateway in terms, and this is what's covered in the open report. The Gateway is a key strategic priority for the council. This relates to an ongoing dispute in relation to the business rates. That's for the period prior to the combined authority acquiring the site. There is ongoing litigation in relation to this dispute, and therefore, given that this is highly confidential, that there are legal matters and there are commercial matters, for the reasons that are set out within the open part of the paper, the proposal is to move this into exempt session.
So I have to read about excluding members of the public. So therefore, I do apologise. Bear with me for 2 seconds. As part of exclusion of the public, the report contains exempt information as defined in the following paragraph, Part 1, Schedule 12A of Local Government 1972, Paragraph 3 relating to the financial or business affairs of any particular person, including the authority holding that information. Paragraph 5, information in respect of which a claim to legal professional privilege could be maintained in legal proceedings. Members are reminded that whilst the following items have been marked as exempt. It is for the meeting to decide whether or not to consider each of them in public or private. In making the decision, members should balance the interests of the individuals or the council itself in having access to the information. In considering their discretion, members should also be mindful of the advice of council officers. Should members decide not to make a decision in public, they are recommended to pass this recommendation that pursuant to section 100A(4) in brackets of the Local Government Act 1972 as amended, the public be excluded from the remaining business from this part of the business of the meeting. There's another item afterwards. In view of the fact that the nature of the proceedings will be such that if the public were present, there would likely be disclosure to them of exempt information, the paragraph 3 and 5 of Part A of Schedule 12A to the said Act as amended. Do I need to read that other bit or not?
No, Chair, we just now need to see whether there's any debate on
Yes.
the proposal to go into.
So that is the proposal. Have I a seconder, and is there any debate? But Councillor Orcott, please. A question about the principle going into confidentiality. But that's fine as long as we don't stretch into the actual.
I understand all of the blurb that you just read out there, Andy, but did we check with the, in the open papers 1.11, it names the people that this relates to. Have we checked with them whether they need this to be in the in closed, or if they would have been happy for it to be in open debate?
Come back on that soon.
Chair, it's my view that we don't need to. This is a decision for the council to take based on its position in relation to the confidential information.
All those in favour? All those against? Any abstentions? One. So that's carried. We will now be going to confidential session of this committee. Right, and thank you for coming back and resolving to come back into open session. We'll do item 11 on the agenda, which is consider the work plan, which are on pages 23 to 28 of the agenda. Any comments on that, please, committee? Any other comments on the? Yeah. Yeah. Councillor Orcott, please.
Yeah, I just want to know, are we getting another update from the Home Choice Plus policy and the Housing Association's letting criteria? We had that on Cabinet on 7th of July. It also does receive an update regarding the Housing Register Systems update. I know that was alluded to earlier, but we haven't quite got a definitive...
I think they're coming back on the 4th of March. Is that the Home Choice Plus policy?
Oh, that was the 4th of March one. Oh, I thought that was about the system. No. Oh, okay then. No. Okay, if that's down for the 4th of March one.
Yeah.
I didn't know if we were going to get that sooner.
Yeah, I think because there was a bit of a time scale, a slight delay, and also I think there was the succession strategy and people leaving and vacancies. Sorry, brain's gone. I think that's why, because Hannah was going to come back then anyway, so she was going to do everything in one on the 4th of March. Sorry, anything else? Because we've been here such a long while, I think we are gradually losing the will to live. I think we've got to come back refreshed. So I think if we temporarily agree our forward work plan, at the next meeting we will be refreshed and come forward with some additional items if necessary. So happy for that one. And item number 12, urgent business. I've not been notified any other urgent business, so I'm hoping to close the meeting 13:47. Thank you very much.